Good afternoon, Dr. Dar. Thanks for being part of the Wellness Lab podcast, where we are looking to help the community expand their knowledge and overall create or help on their wellness. So the topic we're gonna discuss today will be really interesting for anyone to learn how sleep apnea and care through dental practice innovation will help improve their overall sleep and their wellness. So, before diving into the conversation, I'll pass it over to you to provide an intro of what you do, of your business, and then we'll talk about how anyone listening can benefit and learn from your endeavor. Thanks.
Thanks for having me on. Yeah, I'm Dr. Dar Radfar, also known as Dr. Rad. Everything's rad. You guys are rad listening here. So I appreciate you listening to this message that I have, which is 12 to 15 years off your life if you're left untreated for sleep apnea. 5 times higher risk of cancer of any kind if you sleep and you're not getting enough oxygen, which is the definition of sleep apnea, when we don't have enough air going in or stoppages of breathing or even shortness of breath. So there's a very, very big connection to a lot of medical conditions, including death, if we're not sleeping well. Leah, a third of our life is spent sleeping, right? And if we're not doing it well, we're getting up, we're tired throughout the day. Someone's telling us we're snoring. We have medical things like high blood pressure or acid reflux or grinding of our teeth. And a lot of people ask me, as a dentist, practicing for the last 23 years in the Los Angeles area, why am I looking at sleep apnea? Well, in 2009, I had the unfortunate incident of falling asleep at the wheel. I crashed my car into a tree, not knowing I had sleep apnea. At the time, I wasn't overweight. I still am not overweight, but I still have it. You don't judge a book just by its cover. It's not necessarily just for obese people. It has a lot to do with the anatomy of your jaw and the relationship between the tongue and the back of the throat called the soft palate. And so I was all of a sudden started snoring back in 2009, and I was feeling a little more tired, but I never thought it would affect me to a point where I was so tired throughout the day that on the drive home one evening I fell asleep. And so luckily I obviously survived. I don't play victim to that accident, and I'm no longer embarrassed by it because that helped me go into a part of a chapter in my life to understand that sleep apnea is a very, very big problem. I ended up getting a home sleep study, which is much easier than going to the lab. And I can help anyone listening set up for a home sleep study anywhere in the country. And lo and behold, I had apnea. So they gave me this mask to wear, which unfortunately for most people can't be tolerated. It's called a CPAP machine, continuous positive airway pressure. And after 3 weeks, I had to give it back to the physician. I couldn't wear it. And then I got lucky. I saw in a journal, a dental journal, that a mouthpiece, I have one actually in my hand, I wear it every night, that helps keep the airway open and reduces or eliminates snoring for most patients. And so you can breathe better and sleep and wake up feeling refreshed and not feel so grumpy. So guess what? I was the first patient in my own practice. Jumped in the chair. I had my staff at the time. We had gooey molds to take the impressions. Now we have a camera that we can scan, a 3D camera. So yeah, I ended up becoming patient zero in my office, as they call it. And since then, I've been blessed to help over 4,000 patients get treated by this. And also I've trained over 3,000 dentists internationally, so that hopefully they can pay it forward and help their patients.
Amazing. Thank you for sharing all what you have discovered through time and how it started with your personal story. Sometimes that's the best way to really test a product, test what happens, and have a solution in place, which I love. And one of the things that I was going to ask you, you showed us your mouth guard. Is it the same as like the one you wear at night guard? No.
Yeah, so the difference
Okay.
between a night guard and a sleep appliance is the sleep appliance is an upper and lower, and it's attached together, so it helps keep your lower jaw slightly forward to keep your chin almost in like an airway CPR position. So it keeps your jaw from falling back and keeps the tongue from falling back, which can cause that obstruction when the tongue falls back enough, especially if you're sleeping on your back, which is worse because gravity takes the tongue and the jaw, pulls it back towards the back of the throat and causes that vibration, sometimes called snoring, or that suction where the tongue falls back and hits the back of the throat, and you have sleep apnea where there's a total cessation or stoppage of breathing. So by wearing the mouthpiece, most people are used to just wearing a night guard just for grinding to protect their teeth. The night guard itself does not protect you from sleep apnea or reduce sleep apnea, it just protects the teeth. And a lot of times the grinding patients are actually sleep apnea patients. They're grinding their teeth because they have these apneic events, which causes a stress, and then they clench and grind their teeth and they move their jaw while they're grinding forward. And so a lot of times you can look in the mirror, you can self-assess. If you see your lower front teeth are wearing down, that's an indication you're grinding your teeth, moving your jaw forward. You're creating your own mouthpiece almost, that movement of bringing the jaw forward to get your airway open. So those are some of the tail signs: tired throughout the day. Maybe your medical conditions such as acid reflux, high blood pressure, even type 2 diabetes can be related to sleep apnea. We talked about the cancer risks that's out there, heart attack, stroke. But in the mouth, it's grinding patterns, it's dry mouth. If you wake up with dry mouth, you wake up with morning headaches, you're not getting enough oxygen to your brain. These are, again, signs that you need to get a home sleep study and see if you're a candidate for either the mouthpiece or even the CPAP, the oxygen machine.
Amazing. Thank you. Thanks for the clarification. And obviously, the support you offer for the home sleep studies can be found on your website, just to confirm. Perfect.
Yep.
We're sharing that below. So amazing. The other thing that it's not only probably something that will be helpful for yourself, but sometimes for your partner. I've experienced from my husband that he's snoring, and I'm like so upset. One day I was like, "You're gonna go to this clinic and you're gonna get fixed." So you can not only help yourself, others too around you. So a secondary benefit for sure. And the other thing I mentioned, which makes a lot of sense for me, it was something I discovered after talking to you, is okay, the connection of why you will be probably feeling down or having headaches. It makes sense, right? Your brain is not getting enough oxygen, and then that's the result of it. So really interesting to learn and see how it all works and how it connects. Sometimes I find like our dental hygiene or that component in our bodies plays a big role in our overall well-being and health. So really interesting to learn all of these with you today and to see how you have applied it and helping others as well. I know there's lots of information within your website. You have some blogs that will help others learn as they go and find like the right support in place, and obviously get informed to get the right treatment. Perfect. And I know as well on your LinkedIn profile, you share lots of information, what you've been doing. You do a lot of that educational component, which I find helps because without the portion of educating others, then we miss the clarity on, okay, what's in it for me? How will I benefit? So is there anything, I think I found it through your LinkedIn feed, like specific types of supplements or things that will be helpful as well?
Yeah. So first of all, thank you for sharing all the things, especially you shared your personal experience, and a lot of people listening may be sleeping or have slept next to somebody that snores. And, if that's waking you up, your partner's waking you up, that can affect your health. And there's a concept, Lilia, that's called sleep divorce. It's about a third of all marriages, partnerships that live under the same household and snore, they sleep in separate bedrooms. And so as you would imagine, if it can affect intimacy and relationships when they're not sleeping next to their bed partner. So definitely affects both people. And so the other concept you mentioned is what it affects on mental health, depression, anxiety, you're not producing enough serotonin. And of course, wellness is mindset, right? And mindset, your energy is everything. How your energy is when you enter work, when you enter, your home after a long day, your kids, your partner, even yourself, your family, your friends want to see some sort of a positive person. But how can you stay positive? How can you have that positive energy when you slept poorly? You become grumpy. It's almost not only scientific or a chemical imbalance that doesn't get rejuvenated or recuperated because you don't get enough deep sleep when you have sleep apnea, but it's just energy, just not enough energy to be able to have that bubbly, very, very happy personality. So you mentioned two things that I wanted to just make sure. The sleep divorce is real, the mental health is real. So for a person that sleeps next to someone that snores and has a trouble sleeping, there's some very cool supplements that I actually put them in my own sleep supplement called RADZZZ. During COVID, a lot of people had a lot of anxiety. They couldn't sleep. And of course, some of my sleep patients, they were telling me that their mouthpiece is working, but they couldn't shut their brain off. They were taking melatonin, they were taking Tylenol PM, Advil PM, Benadryl, all these over-the-counters, not to mention Xanax and Valium and Ambien and Lunesta, all these sleeping pills. And the problem with those is it really knocks you out. They're liver toxic, they're kidney toxic. And so there's a few supplements that I truly love. Magnesium Glycinate. I love magnesium glycinate. It helps with anxiety, calming, and sleep. Vitamin D3 is very good for sleep as well. I recommend at least 5,000 IUs of vitamin D3, at least 400 milligrams of magnesium glycinate. That form is better for sleep. And then you have natural herbs such as valerian root or chamomile that are very safe for most people to be able to use. At least 200 to 300 milligrams of valerian root is a good idea. The most powerful ingredient is called N-acetylcysteine, also known as NAC, N-A-C. If you just Google NAC and sleep apnea, you'll notice that there's studies that have been done to help lower sleep apnea by up to 30%. And the way it does that is it acts as a natural expectorant to clear the mucus and the inflammation in our airway. So these are just some ideas. Melatonin, I don't like more than 5 milligrams a night. Keep it under 5 milligrams so you don't affect your natural production. And those are some of the supplements out there. I know I went over a lot of them, but you know, my RADZ supplement does definitely have these ingredients in there. That's why I made it. And really in the morning, if there's sunny, if it's sun outside, I do recommend looking into the sunlight early in the morning for about 10 minutes or so. That naturally will boost your own melatonin levels so that 12 hours later, when it gets towards bedtime, you're able to fall asleep a lot quicker and easier.
Great news. So you have it all. That's great. 360, right? So perfect. And I know the other couple of something that called my attention, which I love. There's lots of people in the audience that have pets, so you also had a product for pets, which is really neat. So you've been thinking of a family overall. So that's amazing. Not sure if there's any particular you want to highlight. If not, I know on your website there's all the details.
Yeah, you know, our furry loved ones, our dogs and cats, are an extended member of our family for most people. Some people, it is the only family that we have. And their oral hygiene is super important. There's been linked to major diseases, kidney disease, cancer risk, and many heart issues for dogs and cats that don't have proper good oral hygiene. It is recommended by the Veterinary Association to get their cleanings done once a year. In adults and children, it's in humans, it's twice a year is the minimum recommendation. But what can we do at home? So I created a product called Rad Pet, and Rad Pet has 3 types of hygiene ingredient or materials in there that you can use for your pets. One is a very long toothbrush and also a rubber silicone finger brush with toothpaste that pets seem to tolerate very well. Another one is a water additive. You put about a half of the cap into their drinking water, and as the pet drinks the water, it helps with bacteria and plaque reduction. And finally, dental wipes. They look like little gauze wipes that you could use. Sometimes the brush or the finger brush scares your pet away. It looks more like a little piece of paper towel with toothpaste on it that you can kind of get on onto their teeth and wipe their teeth so that they can have better hygiene. So yeah, I dove into the pet world. I had a very spiritual medium reach out to me and said, you're doing a lot of things for humans when it comes to your supplements, such as your sleep supplement. I have a TNJ supplement for the jaw called Rad Jaw. Why not do something for pets? And I've always wanted to do something. I just thought, I'm not a veterinarian, but being a dentist, it's not too far off if we're concerned and we want to improve the oral health of our pets.
Yes, totally on board. So glad you're thinking of everyone within the household. Perfect. So a couple other things that might be worthwhile to highlight talking about your overall products. You offer shipping in the US, like the US territory?
Yeah, it's shipping Canada, Mexico, and we do have some international countries as
Oh,
well
nice.
that we ship to.
Oh, amazing. I didn't know that. I just assumed it was the US and that's it. So perfect. We have Canadian listeners here. So that's great. And another key thing that might be relevant to highlight from sleep apnea perspective, and then how patients might be able to tell. Obviously, from the get-go, you will find you're sleeping better. You will not have certain symptoms, but talking a bit more into technology, devices, and whatnot, I bet there's a way they can track through their sleep, how they're performing. Maybe they will be more rested, or anything else that you would like to mention.
Yeah, so Fitbits, and I have an Oura ring myself that I wear. They help track your sleep. They give you percentage of deep sleep, which is where the recovery happens. And if you see your percentage is less than 20% of the time, you're getting less than 20% deep sleep. That's a problem. They also talk about oxygen saturation. If it dips too many times, if you see many episodes in an Oura ring report in the morning when you wake up, or in a Fitbit report that your oxygen saturation dipped too many times, that means you're suffocating. So unfortunately, it's not a diagnostic tool. A home sleep study is still required to be able to fully know, but the home sleep studies nowadays, they're so small. It's literally, you wear it around your finger or around your wrist. It's not very cumbersome to do. So it's very easy. It's about up to 10% deviation from one night to another. So we usually like to request at least 2 nights sleep study just to make sure there's accuracy on both nights. If you drink alcohol that night, on one of the nights. Make sure you have your normal kind of weekday and weeknight, so to speak, when you do the sleep studies. Don't just be a completely, if you drink every night glass of wine, then do the same for the sleep studies too, because alcohol does make apnea worse as it dries up the mouth and relaxes. Even though we get sleepy and fall asleep a little easier, it does affect our deep sleep when we drink alcohol. So I do recommend you do get tested if you drink alcohol on a frequent or at least once a week basis.
Great advice. Thank you. And maybe a couple other things that will be interesting. Is there, I know for your specific focus and these devices we have, is there anything you find will be helpful in the near future? Maybe some technology you've heard of to support, or with these things you've mentioned, like supplements, I forget the mouth support, you will let me know the term, but well, those couple things will be really good, and using the right tools for hygiene, I bet it's going to be so helpful as well. But just to see if there's anything else you would like to share with us in terms of any technology in place or something within the near future that will be a great highlight for us to take care of our sleep in this case, or dental health.
Yeah, so you're touching a few treatments of sleep. One of them is, we talked about the CPAP machine, which is the mask, that continuous positive airway pressure. Then we have the mandibular advancement device, or the mouthpiece, that helps with sleep. And then we do have surgeries there are 2 kinds of surgeries. One of the surgery is to actually reposition, if your jaw is very further back, to reposition the jaw forward surgically. And keep it that way in a normal bite situation. That may help alleviate sleep apnea. There's also expansion of the jaw, especially in children, to wear expanders at a young age, between 5 and 12 years old. And you could do it as an adult too, but it's easier to expand the jaw, creating more room for the tongue and correcting your jaw relationship, the lower and the upper jaw. So there's orthodontic intervention that I highly recommend, that if you hear your kids snore or they're bedwetting or they have ADHD symptoms, definitely get it checked out by two types of doctors. A pediatric ENT to check for the adenoids and tonsils to make sure there's no obstruction there. They may require surgery for that, and to be checked by an orthodontist, even if they don't have all their adult teeth yet, to see if they're a candidate for these expanders, so that there's more room for the tongue, and then therefore the airway, it becomes more open as well when there's expanders that are done. There's also another surgical that you can device that can be implanted underneath your chest muscle. It's called Inspire. Inspire is more for severe patients who can't tolerate the CPAP machine. It helps stimulate this nerve of the tongue to keep the tongue slightly contracted through electrical signals that are sent to the tongue. Very advanced stuff. And something that I'm working on is something called low-level laser therapy. Low-level laser therapy is a laser that is used it could be used on babies, it could be used on adults, it could be used on animals. It's been used in the chiropractic space and in the medical space for almost 25 years plus. Now we're using it to show that we can maybe make that palate a little bit more, not as relaxed, a little bit more strong, or we call it taut, a little bit more tight. So there's more room, so the tongue doesn't hit the palate much more faster. It's a little bit more air that goes in if you can lift the palate up by making it tight with this laser. Just the same way lasers can make your skin tight, we can make the soft palate tight. There's no numbing, there's no contraindications, no pain. It's a cold laser. So low-level laser therapy, it can also help with that. It also helps with removing fat around the neck. If patients have a little bit of a bigger neck, the fat can constrict the airway. And unfortunately, obese patients tend to have that. So if you can remove and melt away the fat with low-level laser therapy, the company that I'm specifically working with is called Erchonia, ERCHONIA. They are amazing at this technology. So that's some of the cool stuff, as I call it, to be able to help everyone reduce their sleep apnea and hopefully cure it.
Amazing. So many things we're learning today with you. Thank you. And we're getting close to the end, but I know we've gone and visited how we can improve our personal sleep, our partner sleep, our family overall wellness, and also supplements that are useful. I know also you suggest getting sunlight, enough things like nature-wise and things we need on a day-to-day basis, which is great because it's a holistic view. It's not only like you need this medicine or you need this device. So I like the approach, and you've been thinking of it in all different angles, which is great. And the other thing that I love is that proactive thing. Like if you have kids, what can you do before issues present, or to know there might be an underlying issue that is causing this, right? Like as you mentioned, if they're snoring, maybe they have this structural type of thing happening that will be fixed, and if we do it in a timely manner, we'll save lots of pain or issues in the near future. So amazing, a lot of learning for everyone here.
Yeah, and one of the things I want to leave you all with is your routine at nighttime is really, really crucial to get good sleep. If you can get to bed, around 10 p.m. or your usual nighttime, be consistent with the hour that you go to bed. And, being on our phones is an addiction. I do it. We are on our computers. We watch Netflix at night. Ideally, if you can, with at least 30 minutes, give yourself some time to unwind without an electronic. Maybe perhaps go back to the old school way of reading a book. Or if it's the electronics around, like listening to a podcast, just don't look at a screen within the last 30 minutes before bedtime. And also, if you can journal, like you mentioned a little bit of a holistic approach, not just pharmaceutical or medical or dental based. Journaling, what troubles you have throughout the day, get that out in a page or a paragraph. Express yourself a little bit more about some of the bad things that happen so you can vent, but also more importantly, some of the things that were good that happened. follow it up with that, and maybe a few things, 5 to 10 things you're grateful for every night. That helps lower cortisol levels, helps you ultimately fall asleep and stay asleep longer when you do that kind of, I call it work on yourself.
Beautiful. I love that. Yes, I find what you mentioned, just unplugging, avoiding screens and this blue light, it's great for everyone listening to us. And one of the things that I heard at some point was, why don't you set up an alarm for going to bed, which also helps for us to keep on time and on schedule. So something else that we can explore. Anyone interested, try it and see how it works. But well, amazing, a great conversation today. You can listen to the podcast without watching it. So another thing you can do before bedtime.
Yeah, and if you use blue light eliminating glasses, that does help. But keep in mind, it's not just the screen; it's also the hyperactivity of our mind when we're going from reel to reel or TikTok, to TikTok, and so that can disrupt the mind from calming down. It's not just the light that hits our eyes; it's also what we're doing with our thoughts and the constant, like, nonstop thinking and dopamine release every time we see a story or a video, that could really affect your sleep. So, but if you have to look at a screen and you're working into the night, or you're really catching on make sure you, even if it's your TV, your laptop, or your handheld, get some blue eliminating glasses, blue light eliminating glasses. They have them on Amazon for very cheap.
Great. Thank you for the rad conversation. I loved it, and well, happy to talk to you. Let's keep in touch, and maybe there'll be a future recording too.
Thank you. Yeah, and if anyone
Thank
wants to reach out to me, drrad.net, drrad.net. I'd love to help, and any questions that you may have following this episode to help you all sleep better, so you can have more energy throughout the day.
Amazing. Thank you. A pleasure having you.
Thank
Bye.
you.